In April, when Evelyn Bazibu's daughter raised an alarm that many of her schoolmates were falling ill with COVID-19, Bazibu did not take it seriously until the girl decided to return home without her mother's permission.
She kept on telling me they have isolated 40 beds at school for pupils who have COVID. But the bad thing, Mommy, we are sharing other things, like we are lining up together for food, for water and all that. She was aware. They used to call their friends, their friends' parents, to let them know their kids were sick. And parents came and picked their kids. She also wasn't sure she had COVID until she got home and we saw, according to the symptoms, the way she was speaking, she could have had it.
Bazibu did not take her daughter for a COVID test, but basing on her symptoms, she immediately isolated her and began treating her at home.
I bought zinc, vitamin C and azithro because I heard that's what COVID patients are taking. And when I suspected, I didn't have the 250,000 to take her for checkup. So I just started my own thing, ginger, garlic and lemon. Then she steams herself in the morning and evening. But the concoction we all took.
Many parents are now finding themselves in a similar situation. And with health officials making a clarion call about overflowing hospitals, a number of people with moderate COVID-19 symptoms are treating themselves at home. Dr. Richard Idro, the president of Uganda Medical Association, says that a COVID-19 test is a must before one begins home treatments.
You may be worried that it is COVID when it is just an ordinary flu or it is malaria. And you may miss a bigger thing. Malaria can kill you if it was malaria. Let there be a health unit which knows that you're home, so that in case something goes wrong, there is a place where you can go.
Mixtures of ginger, garlic and lemon are the rave now, with almost every home having a concoction. But doctors recommend that even with home treatments, constantly masking up is a must if you are to control the spread of the disease in the home.
Monitor your temperature every day. The small thermometers, they are 1,000, 2,000 shillings. If you can get one, please use it. And if the temperature goes above 38.5, then you no longer have mild disease. You are developing moderately severe disease or severe disease. You need to go to hospital.
However, are these home treatments effective?
After 2 weeks, she was okay. I couldn't see her sleep all day. Whenever she continued to take the concoction, she couldn't cough again. Yeah, and in the 3rd week, I took her back to school. She did her exams and came back home after exams.
Honey with lemon, with ginger 3 or so times, and some Panadols to make the fever go down and the headaches go down is sufficient. Have at least 30 minutes of sunlight, because vitamin D is very critical in trying to protect our airways and for the lungs to recover.
Pharmacies are seeing an increasing number of people buying what they believe to be COVID drugs over the counter. However, Dr. Idro says a recent spike in diabetic cases can be traced to people taking drugs such as dexamethasone and azithromycin without prescription.
We're already getting many people who are complaining of pain in the abdomen, even children, because people are eating vitamin C tablets, people are taking dexamethasone. We are starting to see a spike of people with diabetes, new cases in hospital, and then even those who previously have had it coming with deranged sugars. Those drugs can affect the way, especially people who take it for more than a week, your cheeks start swelling, your body starts swelling, your skin becomes lighter, it cracks.
Usually, COVID symptoms last between 5 to 14 days. After 2 or 3 weeks of home treatment, Dr. Idro advises that if possible, take a test before coming out into the public again. Gillian Nantume, NTV Weekend Edition.